Our first talk in this session is by Vegard Antun on instabilities of deep learning in image reconstruction.
Thank you. So I call this talk on instabilities of deep learning in image reconstruction part 1. And that's because Matthew Colebrook is coming after me and discussing whether we can construct stable neural networks for image reconstruction. Now this title is the same as a paper we put on archive now in February. And it's joint work with Francesco Renna in Porto, Clarice Poon in Bath, Ben Adcock at Simon Fraser University, and my thesis supervisor, Anders Hansen here in Cambridge. The image reconstruction problem can, in very simple mathematical terms, be described as follows. You have an image, X, which I'm going to describe here as a vector. You can stack the columns on top of each other. And then you have some measurement matrix, A, which is modeling your imaging, which is a model of your imaging modality. So if you do an MR scan, A is going to be a subsampled Fourier transform. If you do CT, it's probably going to be a discretized radon or fan beam projection. And then you have the measurements, which is the inner product between X and the rows of A, and that gives you a Y of measurements. And typically, Y is what you get out of the scanner, and the question is, what is X? And you might also add some noise, E. Now, if M here had been equal to N and A had been invertible, this would be trivial. So this situation we consider is when M is less than N. There are a lot of motivations for this. You will reduce scanning time by doing fewer measurements. You reduce patient discomfort and so on. This is sort of the background for compressive sensing. But of course, if M is less than N, then there will be a lot of X's which actually agrees with your measurements Y. And in that case, the question is, how do you recover X? And without further assumptions, you have an ill-posed problem. So what you typically do is that you either assume sparsity, or now with deep learning, you're trying to learn what X might look like based on your data. So this will be sort of very high level, but the deep learning approach to this inverse problem would be to try to find a neural network, which I call F here, which on a given set performs very well, which is able to recover images. And you can choose to train on the entire set, or you can choose to train on a subset, but usually the measure of success you sort of report is whether you are performing well on a certain set of images. Very sort of simplified. The other approach would be sparse regularization, and this comes in various forms. You could do wavelet recovery, you can try to use the total variation semi-norm, and there exists other optimizations problem you can write up. Some of these optimization problems and minimizers of those comes with recovery guarantees, some does not, some are based on pure heuristics. And in this talk, I'm going to consider sparse regularization as sort of a stable method. It's out in applications. Of course, in sparse regularization, you are not trying to learn something from your data, but rather you are sort of using the prior knowledge that images might be sparse in wavelets or in a TV semi-norm, and so on. Now, we have seen sort of the classification instabilities so far today, and if you do classification, it's very easy to say once you have done something wrong. If you find a perturbation for which your classifier changes the label, then you would say that, this is a perturbation which, well, it might not be a reasonable perturbation, that's something you can discuss, but you have a very clear measure of when you sort of have misclassified something. When you work with images, the output of your algorithm is going to be an image. So how do you say that this is an adversarial image? That's very, very hard to say. So what we instead will have to use is somehow the eyeball metric and say that whenever a clinician might do wrong diagnostics on this because the image is completely deformed or have introduced a false structure, you have an instability. And in our tests, we introduced a test consisting of 3 parts. So you have instabilities with respect to tiny perturbations. So this would be if I can add in the original image X just a tiny perturbation R, so that you don't sample Y, but you sample some Y tilde. And if your algorithm now spits out a completely different image, or an image with some heavy artifacts, you might consider that network to be unstable. You also have the other type of instabilities, which is if you're trained on network now on brain images, and you ask, now there comes in a patient which has a brain tumor in a location where the network had never seen it. Is the network able to capture it? And of course, when you check this, you need to check against what I call state of the art. So there has to be some algorithm which can actually do it. And then you have a third type of instability, which is maybe a more counterintuitive, where you are actually given more samples, so you're given more information, the patient spends more time in the MR scanner, and the network tends to perform worse. This third test doesn't apply to all type of neural networks, it applies to convolutional neural networks. So the third test is not as general as the two upper ones. Trying to find tiny perturbations, we use the following algorithm. It's fairly simple. So you try to find an R so that when you sample X plus R, the difference between what it used to predict and what it now predicts is large. If you try to just maximize this without adding sort of the regularizing term, you would end up with a very, very large R. So you add sort of a lambda, which you need to fine tune a bit, and then you use your favorite gradient descent optimizer. That's sort of, it's not a very sophisticated thing. We use the gradient descent with momentum. And to sort of illustrate some of the results, this is a network which is trained on 33% subsampling. It's done by Shepler et al. At Imperial College. And what you can see is now the image here, X, and the reconstruction, f of AX. And what I'm going to do is that I'm going to try to add a tiny, tiny perturbation here and see if I can change something. So if we do that, you see that now I suddenly washed out this little part and I've introduced a black little dot. And what that means is that, okay, so I'm not a doctor, I don't know, but this might lead to wrong diagnostics if you sort of, with very, very tiny perturbations, can change things. Now I can deform it further. You can sort of go, now I'm going back and forth a bit so that you can see how it moves. So it really just changes. In this last perturbation here, you can actually see a little bit of the perturbations in the image. Maybe at least. I can that on a regular screen, but now it's a bit harder on the projector. But if the scanner now spits out this thing, you might say that the doctor would simply have to redo the scan. He might not be able to do diagnostics on this, so it's not that critical. But it's these very tiny perturbations which might lead to completely wrong results. And of course, what's important is that we need to check that the inverse problem in itself is not unstable. So I'm of course checking whether there exists something which is able to reconstruct it somewhat stably. So this would be the reconstruction with a state-of-the-art sparse regularization algorithm. You can see that it actually spits out something which is reasonable. So the motivation for this is you can't say you sample one sample and you get something out. There wouldn't be anything which could recover that stably. Then you have the automap. This was published in Nature with a follow-up a sort of highlight with AI transforms image reconstruction. So here you have the image, and on the right here you have the reconstruction with the state-of-the-art, and in the middle we have the network reconstruction. And I've added a little heart here so that I sort of can see if I'm able to wash out that detail. And as we can see, once I start to add tiny, tiny perturbations, it sort of washes out the image completely. Again, if you end up with something like this, you would redo the scan. But would you redo it if you sort of end up with these very sort of Gaussian noise-like artifacts? Well, I don't know. You can do the same with a variational network. So this is unraveling sparse regularization procedure. It's done by Hammernick et al. And now to the right here we have the perturbation, and to the left we have the unperturbed image. And when I do the reconstruction, you can see that suddenly I've introduced this very, very heavy artifact. If you do this with state-of-the-art, you end up with something which seems more reasonable. Skipping the next example. Then we have small structural changes. So here we have a network which is trained to reconstruct ellipses images. And now I'm asking, this network have only seen ellipses. Now I'm asking, if I now suddenly introduce a tumor in the form of the text, can you see it, and a tiny, tiny heart, will the network be able to capture this? Now, it's a structure it had never seen. So what do you guys think? So this is the reconstruction. You can see that it completely washes it out, whereas the problem in itself is not unstable. You are actually able to recover it somewhat nicely. So when you make these, you sort of tweak things up and back and forth to find a text which sparse regularization is able to capture. Vegard, I think these guys are from Imperial College as well. Again, introducing a text and seeing whether we can recover it. And the image to the right here now would be the network's reconstruction, and the image to the the left is network reconstruction, and right is state-of-the-art reconstruction. And it seems like the network is sort of washing out the text. It's becoming very, very hard to distinguish. Now we're going back to the deep MRI net. So remember, this network was completely unstable when I added tiny perturbations. We could sort of completely deform the image in whatever sense we wanted. And what I'm doing now is that I add the text, can you see it, to it. So what's very, very surprising is that even though this network is completely unstable when you add tiny perturbations, adding a small structural change, if you look at the reconstruction here, so it will be this guy, it's actually able to capture the text quite nicely, which I find a bit fascinating. And this experiment is also done, so usually it's trained for 33%. I reduced it to 25 just to check it, whether it's able to capture it. And so this is quite remarkable from the network side. Then we have the counterintuitive type of behavior, which is adding more samples. So on the red line here, the red dotted line, is what the sampling percentage the networks are trained to reconstruct. And then on the x-axis, you sort of have the subsampling rate. So if you are above the red line, you are spending more time in the scanner. So you would expect to improve on your results. On the y-axis, we have the PSNR value, which high PSNR value means that you have done a good reconstruction. And as you can see, there are two of the networks. If you change the sampling rate, the image quality starts to decline rather rapidly, whereas for others it doesn't, which is rather absurd, I think. Then, if we were to conclude here, we have seen that tiny perturbations might lead to a myriad of different artifacts. It's not sort of clear to me when I begin with a network or how this relates to architecture, sampling pattern, and so on, what type of artifact you might spit out. There is a variety in failure of recovering structural changes. So we have seen that some of the networks completely washes out new structures, whereas one of them, which were completely unstable, actually are able to capture it. Then you have, are these instabilities universal regardless of architecture? So there are at least sort of 4 of these networks are quite different type of architectures. 2 of them agree a little bit, but it seems like the phenomenon is quite universal, maybe. A valid question is this critical for applications? So once I compute these perturbations, it's not done at random. It's done very carefully, and you can ask, is this something which will happen in practice? Are someone going to attack you in an MR scanner? Well, probably not. But it's valid to ask whether if I take an image with my head like this, and I take an image with a head like this, so you sort of have, are that affecting the result? So are these rare events? Maybe, maybe not. But empirical tests are needed. But what might be interesting then is that if you need to do empirical tests and some networks are unstable when you start to change your sampling rate, would you have to do the empirical test for each network trained at each sampling rate, which might lead to a lot of work to get this approved, for instance. So, thank you.
Okay, any questions for Vegard? Any questions? Yes.
Are all the networks that you've shown us, are they all optimized for L2?
They use, usually they are, I think all of them are trained with the L2 difference between the images, but most of them also have various types of regularization.
Just because I wonder, I've seen several other losses used in image reconstruction. I was wondering if you considered whether some of the artifacts might come from, I've seen some work on the loss being quite a heavy influencer of the kind of reconstruction artifacts that you get. So I was wondering if you considered.
No, I think actually I think all of these have used L2. Some of them, the Dagon used a very advanced loss function, but for instance L1, I don't think any of them used that. So that's a valid question, right? Will things change if you change the optimization problem?
Yes.
Aren't all these three different kinds of instabilities that you showed like kind of related and actually and the question I'm trying to ask is, everything seems structural, and if you have to think this in terms of signal to noise in an image, let's say like you introduce this text and everything, like I can see whatever, like it's all bright, does that like have an effect? Let's say if you have a Poisson noise, or like if you start thinking in terms of how you introduce the
So
I don't know how deep learning works, so.
Okay, yeah. So you want to introduce. I think the two types of noise here are, in some sense, different. The structural one is sort of very specific to one place in the image. So I don't know what. So you can't sort of add Poisson noise to that, or Poisson noise.
Like, so you introduce all white pixels. Let's say the maximum pixels, I can see you, whatever, and then you add some salt and pepper noise to it, or something like that to that text.
Sure.
So how does the network then behave?
That's something I don't know. I have simply not tested. So, but
It's probably the question of random noise versus adversarial noise. Is that maybe?
This is my first talk for this.
okay.
Anything else? No? Okay, so let's thank Vegard again.